March is Colorectal Cancer Awareness Month. It's a very treatable cancer with a high survival rate. So to learn more about the disease and how to catch it early, we're joined now by Dr. Lester Bowser, a gastroenterologist at MedStar Union Memorial Hospital. Thank you so much for coming in, doctor.
Yeah, thank you.
Very important. We just said that it's, treatable if caught early. What is colorectal cancer? What are we talking about when we refer to that area?
So colorectal cancer is any cancer that's found in the large intestine or the rectum. It's just a shortened abbreviation for colon cancer in those areas.
So how's it diagnosed?
There are multiple ways of screening for colon cancer. So screening is where we find evidence of colon cancer by stool testing, as well as colonoscopy, which is the gold standard.
Tell me, why do they call that the gold standard?
It's the gold standard because it allows us to actually look into the colon as well as treat at the same time. So if we see polyps, which are small growths, we can take them out through the colonoscope before they turn into a cancer. So we catch them while they're small.
So the biggest thing that I've always heard people complain about the colonoscopy screening is really the prep, not necessarily the screening itself, because you're out during the screening.
Right.
Has it gotten any better over the years?
The preps are much better. There are variations of the prep. So most of the preps are liquids that we can drink or powders that we reconstitute with water or any clear liquid, whether it's juice or tea, anything that's not red, anything you can kind of see through. We can do split preps as well, where you can drink part of the prep the evening before and then the other half the morning of the procedure. It makes it much easier to get down rather than drinking a big gallon of solution.
So what if you don't have insurance or if you're underinsured?
If you don't have insurance, MedStar has a program that's in conjunction with Baltimore City Health Department at Harbor Hospital. The contact is Michael Sickley. The number there is 410-350-8612.
And we'll have all that information for us on our website. Doctor, what would you say to somebody who's sitting at home and reluctant, they don't want to take off work, they don't want to go through the prep? Why is it so important to have that screening?
It's so important because we recommend anyone over age 50 to have screening. As mentioned earlier, it's the third leading cause of cancer in this country. So with colon cancer screening, again, we can find polyps, we can find the growths when they're small. The procedure is relatively painless.
Relatively.
It's pretty painless, and you're asleep during the procedure, so you're sedated for the procedure. The hardest part is just drinking the prep the day before to clean everything out so we can get a good look.
Okay, all right, he says so. All right, these are the experts standing by in the studio. We are taking your calls until 6:30 tonight. Dr. Bowser, thank you so much for coming in.
Thank you, Kelly.
Appreciate it.